Because of this law, there are other Americans, other sons and daughters, brothers and sisters, fathers and mothers, who will not have to hang their fortunes on chance. These are the Americans for whom we passed this law.
We're back, of course, as President Obama today speaking after the Supreme Court upheld his health care law. What a day it's been for the president. We've talked a lot tonight about the politics of the big decision by the Supreme Court, the 5-4 approving it. But how's it going to affect real people? Zeke Emanuel worked on the Affordable Care Act as a health care advisor to President Obama. He's also an MSNBC contributor, and he chairs the medical ethics and health policy at the University of Pennsylvania. Teresa Brown's an oncology nurse and the author of Critical Care, A New Nurse Faces Death, Life, and Everything in Between. She's also a blogger for the New York Times. Teresa, I want to get to you about a cancer patient or a leukemia patient. Bring it down to what it meant to you and a patient like that, the ruling today.
Well, the issue of why we need the Affordable Care Act was really brought home to me one afternoon when I was taking care of a new leukemia patient who started to talk to me about death panels. And I told him there was no such thing as death panels. And he said, "Oh, really? Because I hoped there were." And he didn't have health insurance, and he was convinced that the care he would need to cure his leukemia would bankrupt his family. He ran his own business. He had worked his whole life. His wife had health insurance, but he was not on her policy. And I'm guessing from things he told me he couldn't afford it. But whatever the reason, he wasn't insured. He'd always been healthy, and then he suddenly was very, very sick. And his wish was for the government to actually assassinate him rather than his family having to lose their livelihood to save his life.
Well, how will his condition be different in terms of his finance if it's $20,000 for these chemo injections, which staggers most of us watching now and listening? How can anything cost $20,000 for an injection? But what will his situation be if this, well, it's been passed into law now. It's clearly unchallenged by the court. So how's it look now for him or a person like him?
It looks so much better because there are so many provisions in the Affordable Care Act that should help so many Americans who couldn't get insurance get it. For the one thing, there are subsidies that will go to people who can't afford insurance. There are plans to expand Medicaid. There are also a lot of provisions to lower the cost of premiums, and that will make insurance more affordable for the average American. So there's lots of different ways, including state-run insurance exchanges, that people who in the past simply couldn't afford insurance should be able to.
Well, let's go to Zeke Emanuel. Let's go. That's micro, and that's what real life is, of course, and it's frightening, the cost of medicine, $20,000 for an injection. But will the individual mandate, which was what was at stake today, and the Chief Justice found with the 5-4 majority, and now we know we all have to do something. No more walking into an ER without some effort on your part, financial part, right, on your part. So how's that going to affect the cost of the average premium to buy insurance?
Well, it's going to bring it down.
How? Explain the mathematics, how it works.
So if people who are uninsured go in, they get services from the hospital or services from a doctor, and they don't pay for them, someone's got to cover those costs because they're not free, whether it's the X-ray machine or the lab test. The hospital folds it into the cost that they charge everyone else who's paying.
And they hit all the insured people.
And it's estimated that on a family premium, it was about over $1,000. And so that'll go down. And then, in addition,
because a lot of healthy people who are young will be getting themselves insured, right?
Well, a lot of healthy people will be insured, but also everyone will have coverage, so we'll pay in. In addition, states were often paying hospitals or doctors who provided this uncompensated care out of general revenue, and that'll go into providing them insurance. And it's not only that the premiums will go down. These people who hitherto didn't have insurance will now be able to get preventative tests. They'll be able to take care of themselves. So maybe their service demand, the number of services they need, will actually go down.
This seems like, when you explain it as a physician, which you are in a public policy, it sounds so simple. Everybody's got to kick into the ability to extend their ability. Why does this darn bill have to be as fat as an old Sears robot catalog? Why does it have to be so thick?
Well, Chris, let me...
No, I mean it, because most people don't like that. They don't like why it's so big and complicated if it's as simple as what you just said.
Let me point out two facts. The decision today, 199 pages, just deciding one issue in the bill. So talk about length. You've got a lot of issues that take a time. The second thing is, it didn't just deal with this insurance access problem. It dealt with cost problems, with the number of doctors and nurses we have, with prevention. There are many things in the bill. Plus, the whole healthcare system is $2.8 trillion, almost 20% of the whole economy. You can't regulate that and get a good law in a very short bill.
Okay, thank you very much, Zeke.
All right, but wait, I want
why did you bring your
Because
prop?
this is my good luck charm for this
is it?
bill. It's broccoli. Now you have to eat your broccoli to stay healthy.
I think I'm with
Justice Scalia.
I'm with, Senior Bush on this one. I don't like it, but I'll eat it when I have to. I eat it when it's on the plate.
It's for
I eat
healthy
when I'm
for
told
you.
to. Teresa, thank you very much for joining us, for going to give us a real life insight to real people, and you for the big picture, which we always need.